performance and as disclosed in Note 14 reflects an amount of Kenya shillings 14,303,980 in respect of grants and subsidies. The amount relates to 5% of revenue allocated to the Office of Director of Health Services to run County Health Management Team, CHMT, activities as per the Facility Improvement Fund Supervision Manual 202. However, during the year under audit, the hospital had disbursed funds to the Director of Medical Services, even after the enactment and operationalization of FIF Act 2023, which does not provide for such grants and subsidies. This transfer was not supported by any update policy post-devolution. In the circumstances, the amount transferred of Kenya shillings 14,303,980 could not be confirmed as a proper charge to their public funds and management was in breach of the law. Thank you, Chair.
Good. So, Governor, response on the two queries.
Thank you, Chair. We are again in agreement with the observation by the AOG that at the time of audit review, the service agreement for managed equipment, service equipment, that is MES, had expired. Following the expiry of the said management engaged the Minister of Health through Council of Governors to facilitate renewal extension of the service contracts. Check the evidence on Annex 4, copy of correspondences between the hospital and the Council of Governors on service agreements for the managed equipment, service equipment. Unfortunately, the Minister of Health has not been able to complete the process of renewing the contracts or engaging different maintenance service programs. Kenya shillings 14,303,980 to the Directorate of, in accordance with the provisions of the FIF, to the Directorate of Medical Services. The Hospital Board of Management had approved the payment of the County Directorate of Health to ensure there existed no gap in financing. Copy of minutes of Hospital Board approving payment of expenditures along with carrying out supportive supervision of facility to ensure compliance with various statutory requirements. Thus, the expenditure incurred relates to the hospital but was managed by the Office of County Directorate of Medical Services. In addition, upon enactment of FIF Act 2023, the Hospital Board passed a resolution to stop remitting the amount. There is the evidence on Annex 7, copy of board resolution on the subject matter. Thank you, Chair.
Auditor, please.
Thank you, Chair. The nitty-gritties of the amount that had been disbursed and the dates disbursed had not been provided during the time of audit. However, during now verification of the responses, the dates of the disbursement revealed that the amount had been disbursed before the enactment of that act. So it was within the timelines, Chair. The issue has now been addressed.
Good. Honorable members, any issue? Good. If there is no issue, because the one with the Minister of Health, it's out of your control. You know, you cannot, there's nothing that you can do. I think the last query, Auditor.
Yeah, Chair, I'm just wondering if they're still using the expired equipment, or they have what they are using now for their patients, and how are the patients surviving in Meru with the expired equipment?
What is expired is the contract between the counties and the MES, which was a MES. So, and they have written to the Ministry of Health through Council of Governors, and they have not responded, and there is nothing they can do. Yeah. So let's go to the last one. Uninsured and unvalued medical equipment. All the others, the policies will give recommendations. And then Governor General later on you'll tell us, you know, lack of approved information, ICT policy, lack of risk policy, lack of disaster. So maybe you'll just give a general comment, but let's look at truck policy you don't have. There is this, we're looking at the deficiencies, non-compliance with Kenya quality model. Yeah, so I think we have two. We have non-compliance with Kenya quality model for health. So maybe we touch, because it's partially, but just touch it so that the governor can tell us and the CEO what they're doing about that.
Thank you, Chair. Non-compliance with the Kenya Quality Model for Health, deficiencies in implementation of universal health coverage, that's UHC, review of hospital records and interviews on verification of services offered, equipment used, and medical specialists in the hospital at the time of audit, reveal that the hospital did not meet requirements of the Kenya Quality Model for Health policy guidelines as detailed below. There are various variances in patient beds. They're supposed to be having 500. They only have.
You don't have to go through that.
Okay, thank
Just
you, Chair.
as below. Then even the governor, you need to tell us, you just highlight. And now that we know you are likely to be moved to level 6, if you are not able to achieve at level 5, how will you do when you go to the next level?
I will invite the CEO, Dr. Beran, to respond, Chair, with your
Thank you, Chair. Yes, indeed, we agree there was some of the human resources that were not at the time of audit, but we're happy to report that there is some progress that has been made. At the time of audit, we didn't have a CT scan in place, but currently we have a state-of-art CT scan. An MRI, we've been able to go through the NEST program, and we are preparing to receive an MRI. Construction is ongoing. We've increased the bed capacity of both ICU and HDU. Currently, we have ICU 8 beds and 8 beds HDU. In terms of clinical nurses, we've also improved the numbers. Through FIF, we've been able to add some nurses in place. So quite a number of steps that have been made since the audit to improve that bit in terms of human resource.
Yes, Senator Kavindu.
Chair, I just wanted to know if they've implemented the FIF Act for Section 5 for the hospital to use the monies in the facility.
Thank you, Chair. Yes, we've been able to implement that, and that's where most of the human resources at Meru Teaching and Referral Hospital, we are able to engage most of the clinicians to be able to cover the gaps that are there. So it's functional.
Senator Amida.
No, Chair, this one I cannot hang them because as a committee member of the health committee, we actually, we were there physically, we inspected the hospital. And this young man has really done us proud. With the short period that, they've been there, they have done a good job so far. That one I can attest to that.
Let's go to the last query.
Thank you, Chair. Uninsured and unvalued medical equipment. But before you go to that, Chair, I want to state that all these policies are now in place. They have been signed and they are there. It's a minimum requirement for them to have in place before they move to, they are elevated to level 6. So uninsured and unvalued medical equipment. The audit review revealed that the medical equipment in the hospital have not been insured, and this leads to greater financial risks as they are exposed to financial liabilities. Further, the equipment has not been valued. In the circumstances, management could not provide the value for the medical equipment being used in the hospital, which could lead to inadequate budgeting for maintenance, upgrades, and replacement, which could result to unexpected financial strain. Thank you, Chair.
Governor, your response.
Thank you, Chair. Our response is as follows. We agree with the audit. We agree with the Auditor General's concern that the hospital did not insure its medical equipment. The equipment are under MES program, and therefore no guidelines have been given on ownership. Going forward, the hospital management will engage the county executive to ensure the medical assets are valued and insured. And already the new equipment that we've procured, that is the CT scan, is already insured, Chair. On these MES equipment, we don't have documents of ownership, and so you can't insure the motor vehicles whose logbook you don't own. Thank you, Chair.
Auditor,
We confirm that the equipment have not been insured. It's still,
can you confirm the ownership? This equipment, it is on whose name?
we don't have any documentation, Chair. Neither does the county has maintained their documents for the ownership document with respect to the mess equipment. Probably, maybe we can liaise with the Minister of Health.
So these are mess equipment.
Yeah.
Oh, okay, then that's okay. So, and members, if any issue before we go to the next one? Amida.
Chair, I just want to, you know, I've never been, I always say mess issues, mess equipments are always messy, very messy. I've done many statements, and until today, they have not even gone through because, of course, everything is messy. So they need to watch out. I'm hoping that this time round, there's another way, especially with the county, now that I think they're able to is it hire, procure, because I think the what is happening with the national government, I think more or less they lease the mess, and then of course then it's paid. So I'm really hoping that you really have to tread carefully on this one, because looking at, you know, the national government and now the counties, when it comes to mess equipment, seriously, you always, you know, lose focus and things go, you know, left. Thank you.
Good, honorable members. All the other queries that we have not dealt with on this particular fund, we will basically have the written submissions so that during our report writing we discuss. We have the last fund. Mark, you wanted to say something?
Yes, Chair. Maybe just a concern on the requirement on the Public Sector County Standards Board that all level 4 and 5 hospitals should prepare financial statements. Maybe the county government can confirm if there are other hospitals and if there are financial statements presented for audit to the Auditor General. Thank you, Chair.
Governor,
Okay.
it's like finance.
Both the CC finance and health, anyone can handle, but finance will be better,
You
please.
tell us how many level 4, level 5 hospitals, and how come we only have one report here?
All of them we have currently submitted. The
Just
auditor
how many?
can confirm.
How many hospitals? Level 4 and 5?
11.
11.
Yes.
So, auditor, they're saying they have 11 and they have submitted reports.
Thank you, Chair. I wish to confirm that this financial year 2024-2025 financial year, they have submitted the level 4 hospital financial statements and they are currently being audited. Thank you.
And that's okay. Let's go to the last, water, and then clerk. You remember the county was here 2023. Yeah? Oh, there are new ones coming in.
Yeah.
Ah, good, sir.
Okay.
You can stretch. You can stand if you want to stand for a minute. The people here. Governor, let them introduce themselves.
Since they are here, Chair, I'll start with the Waziri for Water and Climate Change, then introduce your team.
Thank you. My name is Baptista Moriki, SECM for Water, Environment and Climate Change.